Welcome, everyone, and thank you for joining us at this month's CRC Café. Today, I'm excited to share some insights into our latest research study, the science of smokability. This study is groundbreaking for cannabis cultivators, consumers, regulatory bodies, and the entire global cannabis market. We've partnered with three leading organizations: the nonprofit Network of Applied Pharmacology, directed by Dr. Miyabi Shields and Dr. Riley Kirk; Controlled Chemistry, led by Dr. Marcus Rogan; and the Certified Ganjiers community to help us with the assessment portion. We felt that in order to conduct a study of this caliber, we needed to unite top experts in cultivation, chemistry, natural products, pharmacy, and the go-to experts for smoke assessments. Over the next 2 years, we will collaboratively conduct various phases of the science of smokability experiments. And our goal is to identify the cultivation and processing metrics that yield the most enjoyable smoking experience. This involves both qualitative measures like consumer participation and that feedback assessment designed by the Ganjier community, and the quantitative data from our state-of-the-art inhalation smoking machine. And so why are we conducting this study, and why is it important, and why does it matter? The science of smokability study is designed to enhance product quality and consistency while promoting the sustainability and profitability of our industry. But more importantly, it deepens our scientific understanding of cannabis, both as a medicinal and recreational product. One of our core challenges in the cannabis space is the lack of standardized regulations that are supported by rigorous data. Current research often misses out on the invaluable insights from industry experts and consumers, and without a balance of these perspectives, we cannot fully meet the consumer needs, which leads to non-brand loyalty and leads to non-profitability. So let's try to find that middle ground between the two, and utilize this study to help propel us in a sustainable manner. Another major hurdle is funding. Cannabis research often faces significant financial shortfalls. And to address this, we are actively seeking sponsorships to ensure we have the necessary funds to carry out a study of this caliber effectively. And moreover, we recognize a significant gap in consumer education about cannabis. So by collaborating and partnering with scientists who are also consumer influencers, we aim to bridge that gap. Our study is going to provide valuable insights directly to the consumers, which will also enhance their understanding of what actually makes a quality cannabis smoking experience. Lastly, a study of this scale requires extensive resources, expertise, and time that we as an interdisciplinary team are fortunate to possess. So this positions us uniquely to undertake this ambitious project and contribute meaningfully to the global cannabis industry. So with some of that being said, I'd love to hand this over to Dr. J to talk about how this study will be immediately applicable to cultivation processes, and discuss how you'll be able to implement them after each phase. We complete each phase of the study. Dr. J, take it away.
Thanks, Ashley. So I'm going to go into it a little deeper. Want to talk to you about the specific experiments we're doing and why we chose them, what will come of it, and how that potentially will impact you, what your company is doing, and how things are performed in the future. I mean, it's a big week here. DEA agreeing to go to Schedule 3. Who knows what's going to happen in the next coming year? It's exciting, but it's also nerve-wracking at the same time. But we're all in it together, and all we can do is keep pushing forward, keep learning, keep sharing, and growing as an industry. So phase 1 is water activity. Now, we wanted to pick experiments that would be the foundation. We have people asking, well, let's include greenhouse versus indoor, organic versus not, all of these different things to test, which we plan to, but right now, being in the infancy as an industry, we really have to understand foundational science. We need to have data for these baseline problems. So in our eyes, the decision was easy. First being water activity. Everything's the same. Flower is the same. Treatment of the flower is the same up until after it was rolled into a pre-roll, and then different water activities, different water content treatments were split into 3 groups with these pre-rolls. So I understand we'll probably want to narrow down these variables in the future, but for right now, what we wanted to do was have something that was middle of the road, within range of what most people currently produce pre-rolls, so 0.65. Then we wanted a very high treatment that no one would ever do, as this could be a microbial risk, but just to see the difference, 0.85, and then of course something very low, too dry, really for consumer preference, but we thought it was important to test, so 0.45. And so what did we do with these pre-rolls? Well, as Ashley stated, this is qualitative and quantitative. We want to join science and opinion, science and preference. So we took these pre-rolls, like you see in the picture. We spent a lot of time and a lot of waste trying to understand how can we mail pre-rolls at a very specific water activity and ensure that they're not going to change by time they sit in a mailbox, takes 5 days to get somewhere, unknown parameters that they would face. And so at first we thought it'd be easy as having a pop top. After digging down into it and testing it over and over, 90% of the pop tops held their moisture content, but there was 10% that didn't. So because of that, we took these pop tops and then we individually vacuum sealed these pre-roll tubes, and that has worked perfectly. We also provided the participants a card that shows instructions of how to very, very accurately take the questionnaire, how to, don't open a pre-roll until you're ready to smoke, and a color palette, kind of like you'd get at Lowe's, to really be able to put a number behind the color that they're perceiving with their eyes, to answer this big question of, oh, ash color so important. Might be, but we'll see. So, of course, the participants are taking a qualitative survey. How does this feel? How does this taste? Is there a burning sensation, a tingling, et cetera, et cetera? And so, our N was 300. So we were very proud of how many people wanted to participate and take part of this. Now, we didn't send out the high water activity, as that would be pretty dangerous. Even if it were clean to start with, having a water activity over, 0.8, something could grow. So we didn't want to risk that. Because we are scientists and hard-headed, we certainly smoked it ourselves just to get that feedback, get that feeling. But of course, we didn't send that out to participants. Now, once we have these pre-rolls in the right fashion, we're pairing this qualitative data with what we test for in the lab. Now, I keep going back to ash color, and I think it's important because so many people have these preconceived notions of what it should represent. So ash color, and I'll show you on the next slide a little sneak peek to the results from this experimentation. But we'll also be using a combustion smoking machine. Now, this is a tool to where we can, for simplicity's sake, we plug the pre-roll in, we collect the smoke that goes through, And then we're able to test that. So we're not only testing what's in the pre-roll as is uncombusted, but we're testing what actually goes through to the lungs, terpenes, toxicants, cannabinoids. How is that transfer? Because looking back in other research, there's a lot of variability based on many factors on actual active ingredient delivery. So that's what we'll get to dig into, and that's what's so exciting. We'll be able to look at temperatures. So if you have a really wet pre-roll versus a very dry one, are they burning at different temperatures? And does that temperature and speed of burning affect ash color? Potentially, if it's wetter, maybe it doesn't burn as hot, and maybe there's more organic matter left behind that could influence color. All theories, but all something that we'll have figured out hopefully this week. This week we have the smoking machine, and we're going to start actually smoking these pre-rolls. And so, yeah, qualitative data I covered. And so let's give you a sneak peek. All right, so I'm not going to tell you which is which, but I did want to just show you without any knowledge of what's what. Judge for yourself. Do you see differences in these different lines? I did. In my eyes, number 1 is the whitest, and 2 and 3 progressively getting darker. So I'm not going to tell you what's what, because we committed to revealing that result at the Cannabis Science Conference, but we will certainly give you all of these results. So yeah, big differences in only water content, water activity differences between pre-rolls. So we'll come back to that. All right, so phase 2 will be a very, very inclusive study, even more so important than the water activity. This really represents the importance of what you do to the plant, what those inputs are, and how that impacts the quality of the smoke. But because these are plants, and because different nutrient concentrations can do many different things physically to the plant, it's not just that. This study will be able to show us, at certain elevated nutrients, like in the picture, what is that effect? And so this was just a very quick and dirty preview experiment that I ran. I don't know, it was probably 6 months ago now, where I simply looked at elevated potassium and magnesium and the difference. And then, of course, control, which is the 0, and then tap, which is no fertilizer. Very significant differences aesthetically in the physiology of the plant because of these different nutrient loads. But we can't stop there. As a horticulturalist, we want to stop there, but because this is a medicine, this is something people put in their bodies, we can do better than just making the plant healthy. We also have to provide a plant which delivers a healthy smoke to those who need this for a medicine, and not have the medicine be an actual toxicant. And so I just want to make it very clear that we are not on a goal to make smoking a more scary thing. I smoke, most of my team smokes, and so we want to be able to prove that it is healthy, or at least be able to gather those methods to have it more healthy. And so still shaping the exact details around this one, because every day I read something new and there's another treatment I want to apply. So this will be narrowed down, working on this for Q3, Q4. So there's a little bit of time. So if you have any feedback, please hit me up and let me know what you think. But in general, this is going to be a study that looks at high EC. So I really want to get down to, the people that are shooting for 3 or 4 EC, with really nitrogen being that input change. What does that equate to? as far as quality in the smoke. And then, of course, other elevated nutrients. And so this whole study came to fruition from reading back through the tobacco journals and seeing how specific hemp farmers, how specific tobacco farmers need to be in order to reduce the amount of toxins they're bringing through on the smoke. Working on the agricultural side to have that end consumer product be safe. So we want to have certain elevated nutrients: magnesium, calcium, potassium. In tobacco literature, all of these elements can have a great effect on quality of smoking. Everything from how the ash hangs on, the strength of the ash, to the color of the ash, to the amount of toxicants that can be converted from certain elements being at higher concentrations from the others. So there's a lot to dig in here, but we'll also be able to throw on top of this flushing. For years, we've got research on flushing that shows, sure, you can say fertilizer. We've got research to show, sure, you may not reduce yield, but what about fertilizers and their impact on smoking? And so that's what we will be digging into. Of course, we'll investigate ash color. We'll look at what's delivered with the smoking machine, what's delivered through. We can even look at heavy metals. How many of these heavy metals that may be in this fertilizer, in this growing media, actually translates through in the smoke. And tobacco, they found that I believe it's 35% of those heavy metals, which are in a cigarette, do not convert through. Interesting figures we need to know in order to have standards and have a healthy industry. Again, we'll look at temperature, organic content, qualitative data. And again, this will be a study where we'll have to handpick which treatments could be sent out to participants, because we don't want to make anything unsafe for those participants. We'll get to dig in much deeper into the plant science side, because this isn't just a post-harvest study. We'll look at yield. We'll look at nutrient content within the flowers. We'll look at aesthetics of how the flower turns out, density, elemental analysis, of course, heavy metals and heavy metal transfer. We're going to look at carbohydrates. If you're flushing, are you encouraging senescence where you are getting more sugars? It tastes better? I don't know, but we will definitely see. And pH. pH is a big one in the tobacco industry. A certain pH can make the smoke not taste as good. So we'll dig into that too. So again, much more to shape around this study, but I think this explains the overall goal and where we're trying to go. Now, again, I want to make it very clear that our goal is not to prove that smoking is unhealthy. Our goal is to be real and know what is there, know what is produced as is. If there is toxicants and nitrosamines that are very abundant, there are certain things we can do on the cultivation side to lower that, to lower the potential chance of mutagens in our medicine. So that's what we'll be doing. Here's a paper, fairly recent, out of the tobacco industry, looking at curing and fertilization effect on nitrosamines. There are things we can do to make our products healthier. I hope this correlates with fertility and yield, but we will see. I think this is very important, and I know for my own sake, as I am a smoker, I want to know what's there and how to manipulate it to be the healthiest product possible. So thank you for listening. Like I said, Experiment 1, Phase 1, we've already sent out and got results from participants. And then this week, actually, we will be using the combustion smoking machine to dig into it a little deeper and see what goes through those pre-rolls. So You guys are supporters. You are wonderful. I hope this can really change the way we do things, provide some data, build ourselves as an industry, and make standards off of science, as well as quality and what people who do smoke and use this as a medicine, can depend on. So if you or your company is interested in supporting this research a little further, that would be wonderful, as this is the future of our industry, is digging deeper, understanding what's healthy, and pushing that as hard as we can. Thank you.